talked about nutrition, we talked about stress and mental stuff and emotional stuff. What about exercise?
Well, I'm a huge believer in exercise, and so I have to tell you, as a potential conflict of interest, I think it is just as important as your medicines. So I tell my patients, exercise is very simple. Only exercise on the days that you eat. So then they say to me, that means every day. And I say, exactly right. I say, of course, if you have terrible flu and you're in bed, you're not going to exercise that. But every ordinary day, you need to do exercise. I'm not telling you to go to the gym and lift 200 pounds of steel and turn yourself, into a super athlete. I'm saying you need to do every day 30 to 45 minutes of a brisk walk, going on your bicycle, going for a swim, or going to the gym and doing one of the machines and so forth. Depends on the weather, depends on your situation and so forth. But you should exercise every day. And I do it. I do an hour and a half every single day, some days 2 hours. My wife does as well.
That's wonderful. What does that do for a person? How does that help?
Well, we could spend the next hour talking about the benefits of exercise. Let me give you an analogy. 10,000 years ago, our DNA was the same as it is today. There were no cars, there was no electricity, there was no running water. Everything had to be done by hand, and if you wanted to eat, you either had to grow your food or you had to catch your food, and if you go back even a little further, you had to be careful that you didn't become somebody's food. So there was constant activity. Well, think of the lifestyle today, right? We take the car 2 blocks, or at least Americans do, they got to run an errand, or they're sitting on the couch all evening eating bad foods that are heavily sugar or simple carbs, getting fat, and they're not exercising. So our DNA, our heritage has built into it, because it was from our ancestors from tens of thousands of years earlier, that we need to be active. Absolutely active. And there's all kinds of scientific information. It's the one area where every study is positive. Every study of exercise is positive, whether it's really where you have a control group or whether you're looking at population data and so forth. Regular exercise is absolutely essential. And again, it doesn't have to be Olympic style training. You don't need a trainer, but perfectly adequate is 30 to 40 minutes of brisk walking a day. Right here, of course, we're on the beautiful Mediterranean. Right in Tel Aviv, you have the most beautiful place to walk. And I see lots of people out walking and jogging and so forth. And I think that's absolutely an essential component. And it is synergistic. What does that mean? It means it magnifies the beneficial effects of the drugs. So if you have atherosclerosis, exercise on top of the drugs is very important. And cardiac rehabilitation programs, secondary prevention programs are very strong in emphasizing regular forms of exercise.
What would you advise somebody who, say, they had a heart attack a few years ago, and they weren't so motivated, they were depressed afterwards, they went home, they sat around a lot, they've been reading, some family members nagging them, they should start exercising.
Yeah.
Should they just start exercising? Mm-hmm. Should they get checked out? What should they do? Do they need a stress test first? Mm-hmm.
Well, we used to recommend that they get a stress test, particularly if there are any disquieting symptoms, like climbing a flight of stairs makes them very short of breath or gives them chest discomfort. What I tell my patients is, if they say they're not having any chest pains, it looks to me like the heart attack is well healed, I say start gradually. First of all, get good shoes, because we don't want you to have orthopedic problems and then say, oh, the exercise was terrible because I hurt my feet, I'm not going to do this. And then start a walking program or get a stationary bike. And the first days, walk 10 minutes at a leisurely pace, and over a period of a month, build yourself up. If you're very concerned, of course, you should be doing this in conjunction with your doctor, and the doctor, or your nurse practitioner may recommend an exercise test, so we see what your heart does, that they're not dangerous electrical short circuits and that sort of thing. But often, if you've had a heart attack, a lot of that has been done at the time of the hospitalization or shortly thereafter. But it is important not to say, okay, I'm going to exercise today, I'm going out and I'm going to jog 5 miles. That's a very bad idea. Even if you don't cause some problem with your heart, you're going to be hurting, you're probably going to have tendonitis and arthritis and so forth the next day. You're going to say, oh, this was a terrible idea. So start gradually and build up. And this is true even if you're 80 years old. We now know that older people need exercise as much, if not more, than young people because you tend to lose muscle. And the best way to fight losing muscle and getting weak so you fall and break your hip is to start doing some exercise. Again, maybe not the same level of exercise you did when you were age 40, but it's very important. And I see here on the, on the water, on the oceanside walk, lots of 80-year-olds out there walking, sometimes with a cane if they're, have arthritis. I tell my patients, absolutely, the best thing you can do, besides taking your pills and stop smoking.
Right.